First tonight, public health experts say Minnesota is experiencing a so-called COVID blizzard, but with information on the virus evolving quickly, Mayo Clinic is hoping to clear up some of the haze. KIMT News 3's Anthony Monzon has the latest insights from a top Mayo Clinic expert. He joins us live tonight. Anthony?
Well, Katie, COVID conditions across the country as a whole have really been improving over the past few weeks. But here in the upper Midwest, case counts are moving in the opposite direction. And with terms like booster shots and waning immunity becoming part of our pandemic vocabulary, a top Mayo Clinic expert is working to clear up some of the confusion. COVID cases once again climbing across the North Star State as winter sets in. While this year's spike comes on a familiar spot on the calendar, Mayo Clinic infectious disease expert Dr. Avinash Virk says this year is different.
Two things have changed. One is that we do have more people who are vaccinated, so there is some protection there. However, on the other side, more people are not masking and have relaxed their social distancing and other behaviors.
And with many Minnesotans having been vaccinated months ago, experts are now worried about waning immunity.
There have been a number of studies that have shown that over time, the immunity does wane against infection, particularly with the Delta variant being the predominant variant that has been circulating. What we have learned is that the waning immunity is more in regards to waning against infections in general, but hospitalization protection from the vaccine has stayed extremely stable.
Breakthrough infections are still rare, the doctor says, and despite the prospect of waning immunity, data shows those who roll up their sleeves are still much more protected against COVID.
The rate of infection in the unvaccinated is anywhere from 13 to 15 times higher than in the individuals that are vaccinated. Also, we have learned in the last few weeks that individuals that previously had COVID-19 infection who got vaccination had a 5-time lower risk of reinfection.
High-risk groups are now being given an additional vaccine dose, but booster shots are likely on the way for a wider section of the public. Dr. Virk says you can think of boosters as your body's way of getting to know somebody new. After one encounter, you may not remember their name, but given a few more, you'll likely have more to remember the next time you see them.
Studies have also shown that boosters have increased the antibody response significantly after the third dose, much higher than even the second dose.
And for otherwise healthy folks who may soon have a booster choice before them,
it may not be so much in terms of protection for them from getting into the hospital and dying from it, but more for us to decrease the overall burden of infection in our country as a whole.
Now, one outstanding question is whether we'll continue needing COVID boosters for years to come going into the future, and Dr. Virk says there's really no clear answer to that question. She says boosters for some viruses like hepatitis B provide decades of protection, while others like that for influenza are much shorter, but ultimately we'll just have to see how the virus responds to this upcoming round of boosters. Live in Rochester, Anthony Monzon, KIMT News 3.
Thanks, Anthony. And given the ongoing spike of COVID cases across the upper Midwest, Dr. Virk and Mayo Clinic are urging communities to take familiar pandemic protocols like masking, social distancing, and of course, vaccination.